The primary reason that someone needs a lift is if their nipple position is too low. The nipple on the breast mound should be above or at the fold underneath the breast. If a patient has sagging breasts, nipples that have kind of descended and are lower than they should be, that patient is a good candidate for a breast lift. If you're a patient who does need a breast lift and you just put in the implant, that implant will be in a much higher position and the rest of your breast tissue will still be in that lower position that it started in. So it's gonna make that problem worse. If they are a candidate for a breast lift and need a breast lift, if they want implants with that lift or not. Again, that's something that depends on the patient's goals, and sometimes an implant is needed to give them more of that upper pull fullness that they're looking for. Other people are coming to the table with a lot of breast tissue and they might not necessarily need an implant. Just a lift without implants is an awesome surgery for the right patient. They can still have a lifted, natural look. It's nice because if you don't have to have an implant, you don't have to worry about implant surveillance and maintenance over the lifetime of that device. We can use different types of mesh to better support the patient's own tissue, and there are patients who come to us, whether because of genetics, weight loss, the ability to use some of these meshes to provide more internal support is huge and helps with long-term results for these patients. The recovery on a mastopexy is pretty quick. We're not doing any work underneath your muscle. You honestly have less soreness than when there's an implant underneath that muscle. So similar to the rapid recovery program that we have our breast augmentation patients on, we do something very similar for the mastopexy patients. When you come to Meridian Plastic Surgery, I'm going to be able to choose from our wide selection of implants, meshes, and really give you the most customized, individualized surgery that's best for you.